So the diagnosis is still primarily a clinical diagnosis. So it really is something where the neurologist has to listen very carefully to the history and very carefully examine each patient. And then based on criteria, and there are several international criteria that are now available to us, based on those criteria then the neurologist is able to make the diagnosis of ALS. Now, as part of this, we often do use various tests, so tests that exclude other diseases that can look something like ALS. So these would include things like EMGs or electromyography, would include MRI scans, and also blood tests. But again, at the end of the day, it is a clinical diagnosis. Most appropriate therapies that provide support for patients with ALS and make a tremendous difference in outcome are really supportive treatments. So very good nutrition, making sure that patients have appropriate physical therapy, occupational therapy, speech therapy, pulmonary therapy, and other supportive care. There is a great deal of research that is currently going on into new medications. This is an area that has literally exploded scientifically within the past decade. We have recently become a member of the Northeast ALS Consortium and are very proud to work with that tremendous group of people to provide future expanded care options. So these would be medications that have not been approved but have been trialed in previous trials and may be of value to patients with ALS, and getting involved in new drug trials to look at new medications which may be potentially of value. And I think that this is an area that all patients with ALS should want to get involved with, because this is a chance then to move from medications which slow down the disease to medications that reverse the disease. At this point, there is no cure for the disease. So yes, we are slowing it down, but we make a really great impact on the quality of life for patients. And so it's been very clearly shown that multidisciplinary ALS clinics, of which the one at CAMC is a multidisciplinary clinic, actually have a huge impact on quality of life for patients. And there are many things that we can do other than medications which really change quality of life and make the time that patients with ALS have really far more beneficial for their overall welfare.